Hi, Kim. How are you?
Hi, I'm just fine. Well,
Good.
I'm really glad that you could join us today for this comprehensive session on vaccine awareness. So I would like to introduce everybody to Nick Butler. He's our medical director, and he's been very helpful for the past 9 months with this COVID outbreak. And he's also a physician at the University of Iowa. So I'll just let you jump right in and tell everybody a little bit about yourself.
So I'm a family doctor and geriatrician. I've been medical director. I'm not sure what 2, 3 years now. It's been a
Mhm.
while. And what's interesting is every single day of my life since the beginning of March has dealt with COVID in one way or the other. And what's been most interesting about this is I think your leadership there at Oak Knoll and Kim and Steve and Sarah have had similar experience. And I know that because I've been talking with them and working with them very closely through these months. And as you think about all the things we've asked you to do, I want to first say thank you because we've asked a lot of each and every single one of you, be it from PPE to looking how you go about your day-to-day life at home, and all of our workflows and all the innovative ideas that people have come to us with has been fantastic. And we knew early on that this was not gonna, all the answers were not gonna come from just a few of us. That it really was from all of us, from paying attention to what other people were doing, other organizations were doing, but also worked for us and for our residents and our staff. And so genuinely, I think now is not the time to rest. Even after you get immunizations, now is not then is not the time to rest either. We have to stay extremely vigilant because this virus is extremely dangerous for our residents and for all of us. And but I don't want all of our efforts to go unrecognized because we have done a fantastic job. All of you have done a fantastic job, and I sincerely thank you. So with that, then Kim, we can happy to talk about other things.
Okay, well, I appreciate that. Thank you very much. So we asked the staff, and we've asked the staff from all over the state actually with this ECHO project that we're doing in helping nursing homes keep COVID out all over the state. What questions would you ask if you had, um, physicians and public health professionals and pharmacists sitting in front of you? What are you worried about with the vaccine? And so we were able to get a lot of questions out of people. And so I'll just go over a couple of questions with you. First and foremost, will the shot make me sick? And by that, I mean, will I have flu-like symptoms after I get the vaccine?
I like that contingency. In other words, will I have flu-like symptoms? Because I think that's a common expectation. Frankly, I think that's a normal response of your body when it's developing immunity. You kind of want that. It's not fun to go through, but that means your body is responding in the appropriate way as the vaccination's intended. So as I understand, particularly the Pfizer and Moderna immunizations, those are the two that are going to be the first to market. They're mRNA vaccinations. They can't make you sick. They can make you feel ill, but they can't make you sick with coronavirus. And so, to me, that's a good response. It's a healthy response, and that's what your body needs, and that's how you know that it's making the antibodies and forming that immunity that's going to hopefully provide each and every one of us some protection.
All right, thank you very much. Um, I'll ask you, I don't know if you know the answer to this, but I'll ask you anyway.
Mhm.
Do you know, will there be any mandation for this vaccine? So I'll just broaden the question. I have several questions about a mandate. So are there any plans that you know of for a national mandate? Will there be a state mandate? Is the University of Iowa going to mandate the vaccine? And will Oak Knoll mandate the vaccine?
So I think Steve would be best to answer. I think as we think about population health and we think about um, what's necessary for controlling infection, I think we need to think locally. So Oak Knoll, then Johnson County, then Iowa, then the greater United States. And so what are we going to do locally? So I think that that's up to Oaknoll to decide whether or not Steve decides to make it mandatory. I think that's an Oaknoll decision. I don't think we should get to the point that we make it mandatory that people get immunizations or not. Ultimately, at the end of the day, it's your body. But I do think that it's about the greater good at this point and the safety of everyone else. And when you're talking that we are approaching 300,000 dead from this virus that we know of, I think that should speak very heavy for why we need to do something about it. So will there be a mandate at Oaknoll? I think that's for Oaknoll to decide, and its board of directors and leadership. As for state and federal levels, I haven't heard of any mandates of this.
Okay.
And as for the university, no. As best as I know, because we're a state institution, they will not be mandating it.
Mm-hmm. So I will add in here and maybe later, as long as we're under the emergency use authorization, nothing will be mandated. It's not recommended that anything be mandated under emergency use authorization. And I don't mandate the influenza vaccine here, and I don't think that I'll recommend that we mandate this vaccine here, but everything in me wants to mandate it. I just want people to get vaccinated. So the only way that we're going to move forward in our process here and not just stay where we're at with all of our restrictions and our new normal, or our now normal, as some people are saying, the only way we're going to move forward right now and get past this virus is to get vaccinated and surround our residents and our vulnerable population with people who are vaccinated. And so that's why we're doing the education, because the only way that you can make an informed choice for yourselves is if you have the information, and we're trying to provide you with the best information we have available, so you can make a good choice for yourselves. So no mandate for Oaknoll, and no bigger mandates I see coming anytime soon.
I think, to me, the mandate is the mortality and the morbidity that is very true with this immunization. The question I have for you is, do you think that this immunization is going to kill 300,000 people?
Right.
Is it going to cause the same harm that COVID has? And I think the answer to that is very easily no. It will not cause the same level of harm as what COVID has. And if we let COVID continue, that is what we have to expect, continued losses, similar to what we've seen over the past year.
Thank you. I understand these vaccines utilize mRNA technology. Can you explain a little more about how the vaccine works and the difference between the vaccines currently available?
An mRNA vaccine, I think Dr. Winokur would be able to give us a very good explanation for this, but as I understand them, this will be the first mRNA vaccinations that have ever been deployed or used. It's not that it hasn't been tried before. A lot of it is that mRNA is naturally an unstable molecule. So let's first back up and do just a bit of basic science to understand what mRNA is. So within the cell, you have the nucleus. So within the nucleus, you have your DNA. All of our cells has our DNA. In order for that DNA to take any action, mRNA is formed as a kind of a copy of that DNA. That mRNA then leaves the cell nucleus, goes out into the cell body, into the cytoplasm, where then that mRNA then is the blueprint for our proteins. And all the proteins, that's the business end of kind of the cell's function. Okay, that's how our cells work, is by the proteins. And so that's what mRNA is. Okay, so it's called messenger RNA. Mm-hmm. And messenger RNA is not made to hang around for a long time. It's there to go outside of the cell or outside the nucleus, out in the cytoplasm, and get turned into proteins, and that's it. And so the way this works, and so it's an unstable thing. So we can't have we haven't been able to have wide distribution of mRNA vaccinations because they have to be, one, very, very cold, held very cold, almost 100 degrees below zero, in order to maintain them to be stable. And many times, once you thaw them out, you have a very short window to get these administered, and so there's risk of waste with these. The reason, as I understand, that they went with mRNA vaccinations, though, is that you can produce mRNA very quickly. So they can make a large volume of vaccine very quickly. And as I understand it too, because it makes these proteins, then you can be very specific about what gets presented to the immune system to form immunity. And then from that, then you can elicit a very good immune response. So the advantage of mRNA vaccination is when you get it injected into you, it breaks down within a matter of hours. So it's not within your system. And that mRNA cannot go back into the nucleus. That's not the way things work. And so it can't be reintroduced into your DNA. It can't alter anything there. All it is doing is it's using your body's own natural systems to build proteins such that you build immunity. And so it's a real slick process. And so it's much different than previous immunizations, but it's much quicker in terms of being able to produce this stuff, as I understand it. And I'm really interested to hear what Dr. Winograd has to say.
And let me clarify just one point there. So I had someone ask me previously earlier in the week, how do you know that the vaccine won't cause the long-term damage that we're starting to see from the COVID virus itself? So the lung damage, the liver damage, the inflammation damage. Would you say then that it is not actually giving you the COVID disease, so you're not having the long-term effects from the vaccine because it's just mirroring the disease? It's tricking your body into creating antibodies?
Yeah, so if you think, let me use maybe this jar with string in it.
Okay.
I'm just stumbling upon this. If we take the mRNA, okay, the whole genetic sequence of the COVID virus makes this whole jar, for example, okay? What we're doing is we're taking mRNA that codes for maybe this red piece of string. Okay, this red piece of string only exists for COVID. This isn't a human kind of protein. Okay, so this mRNA codes for this. So then when we give this piece of mRNA that codes for this part of protein, this part of the coronavirus, this little string isn't the coronavirus. You need the whole piece of coronavirus to get you sick. Just this little string, that can't make you sick. And so this is what we're introducing to your body, essentially through mRNA. This is what gets made by your body as a protein, and that is what gets presented to your body, then that elicits the immune response. So as it pertains to this type of virus, there are other viruses that or other immunizations where we introduce dead virus or virus that's just weaker version of its normal self. With these, we're giving you essentially your body ability to form a part of the virus. So the virus itself is never in its entirety inside of you.
Okay, that's great. Thank you. So will I have immunity right away following the shot?
I'm not going to say, if you mean by immunity right away, you mean like you get the shot and you can walk outside and take off your mask and all that sort of stuff. No, your body needs time to react to that. And so you have several phases of immunity. You have your first phase of IgM formation, which is our early antibodies, but then it takes several weeks to build cellular and long-term immunity. So at least by a month to 6 weeks, your immunity would be at that point.
Okay, thank you. If I'm diagnosed with an autoimmune disorder such as MS or RA or lupus, should I take this vaccine?
I think that's a good question for you and your doctor to talk about. I think you need to consider that. I think we need to take guidance from CDC and the AICP on what we should or shouldn't do and what people are at risk and what people aren't for this vaccination. I would encourage you to talk to your doctors because you are immunosuppressed. And we know that people with chronic conditions do worse when they get actual coronavirus, the SARS-CoV-2 infection. Mm-hmm. And so I would strongly encourage you to talk to your doctor about whether or not you should get this done. Because I think that's a very individual and specific question to your health needs.
Okay, thank you. Can you talk to us just a little bit about how this vaccine seemed to happen so quickly. So were there steps in the protocol that were skipped or were rapidly sped up so that this vaccine might not be as safe as usual?
So Kim, that's a good question. I'll tell you, Dr. Winokur is going to have a very good answer for that.
Okay.
And what's interesting is that much of the work in terms of the animal models that built the foundations for our human studies came out of MERS and the original SARS virus. And so a lot of the basic science foundation had been established for that. And so as I understand it, and this is kind of maybe hearsay, but I heard Moderna had within 2 days, they had their mRNA vaccination in place, and then it was just getting it out to trial. Because so much of the basic science had been done because of the previous coronavirus outbreaks. The first one was SARS-1, and then the second with MERS, which is still smoldering and ongoing at a very low level.
That's great. This is a very specific question, but I'll see if you can answer it. One of my staff members who had a rather severe COVID infection back in April, this is not an Oaknoll question, but has asked if people who have already had COVID will be recommended to get the vaccine or if it would be unnecessary since they've already had COVID.
So I think this speaks back to the fact that you can get recurrent COVID infections even with previous infection. And this is what we don't know about this vaccination, as well as we don't know how long immunity lasts. And so the previous infection that you had, you very well may have lost your immunity that you had developed at that infection such that you're at risk for getting another infection. As I understand, at least how the university is going to roll this out, is that there's not going to be any sort of pre-testing for antibodies or anything like that. If you've had this before, it's going to be, we're doing it. And in some ways, I'm not advocating that people go out and get a COVID infection before they get the immunization, but by you having previously had a coronavirus infection, SARS-CoV-2 infection, it stands to reason that if immunity has been maintained inside of you and protective immunity has been maintained inside of you, this is going to act as a booster for you. This could actually help you. And so consider it that way.
Okay. Oh, this is a good question. I had a really bad experience with the new shingles vaccine. The first dose, I had chills, fever, muscle pain, and could barely get out of bed. I told the pharmacist about my reaction, and he reassured me that it probably wouldn't happen with the second dose. Unfortunately, I had exactly the same symptoms. I missed 2 days of work. Will the COVID vaccine show similar reactions in me?
I'm never going to speak to the individual to say at the individual level, this is what you are going to have, because I think it's always a spectrum. We need to think of it that way. But to me, that tells me that you have a robust immune system. The fact that you were able to develop a good response, to me, as I mentioned earlier, that's a healthy response. That's what you want. You want your body to see that and kick its butt. That's what you want. And to me, when I hear that, I'm sorry that you went through that and didn't feel well. But from a health standpoint, from a protective standpoint, I think that's a good sign. And the fact that you have had that with the previous immunization, does it stand to reason that you could get it with this? Yeah, it does. But I don't think that should deter you from doing this. I think as we think about how this should be rolled out across Oaknoll, and I think those details are still being worked out with our Department of Public Health, how we're going to roll this out. But I think there needs to be some sort of a staggered approach to how we roll this out within our own staff, because I think we have to anticipate that some people are going to be out of work for a day or two with flu-like symptoms after being immunized. And while I would love to see us do a big bang, broad immunization, get everyone at the same time for sake of ease, convenience, and just making sure everyone gets it done.
Right.
I think we need to plan on a certain percentage of our staff, as yet to kind of be determined, who are going to be out feeling ill after getting the immunization.
We'll let Sam from Public Health talk about that a little bit more, but we are planning a staggered approach for sure, so that we don't knock everybody out.
That's great.
Out of commission at the same time.
Yep.
Are there any, is there any evidence published in peer-reviewed journals that's available? I know that Dr. Winokur can probably speak to that. Phase 2 results were probably published as they were going on to phase 3, but.
I remember seeing something in New England Journal, but I think that's a good Dr. Winokur question.
Okay. Any issues if latex was used in the process of making the vaccine that could potentially cause at least hives and at worst anaphylactic shock in someone receiving the vaccine?
I don't know about latex. I think we need to ask Dr. Winokur. I would like to hear Dr. Winokur's opinion on that. I know that recently there has been a couple of cases of anaphylaxis with the immunization in England, where they started rolling this out sooner. And I think that we have to expect that in some way. So as Kim and Sarah and Steve and I kind of talk about how we're going to immunize our residents and employees, we will need to have proper, epinephrine and other things in place should someone develop such a reaction.
Okay. I think I've exhausted the list of questions I have available today. Do you have anything you think I forgot to cover?
One last thing would be that just because we get immunized doesn't mean we can let down our guard. I mentioned that at the outset. I think that as healthcare workers and as nursing home residents, we're going to be the first to get this. But when the supply chain is able to meet the demand for general population immunization, I don't know when that is. And since we don't know if we're going to need to do a reimmunization, so how well immunity stays, that's going to be part of this study. That's going to be part of what is going to be evaluated on this. I think we have to be just as diligent about wearing our masks, just as diligent about avoiding groups, just as diligent about washing hands and 6-foot distancing. And I don't think this changes anything for what we're going to do day to day. I think this is going to be a game changer, though, because you look at what happens when this gets in a nursing home, and it can kill up to 1 in 4 of the people that it infects, and it runs rampant in a nursing home. And I think it'll be a game changer in terms of the level of security and safety that we can assure our residents. But I don't think it should change anything that we do, because I think this is a piece of the larger puzzle that we all need to think about.
Yeah. Maybe late summer.
Mm-hmm.
We can think about a party.
Yeah. I do think that the political environment is something that needs to be addressed, though, too. I think that there are people on both sides. I think there's people on the right who feel that this isn't a real issue. I think there's people on the left who feel that this has been a Trump administration that's been forced down everyone's throat. And I think I'm going to try to give some reason to that rather than just looking at it from a singular political lens. I think the left commonly would say, well, we need to follow the science. Early on in this, we need to follow the science. We need to follow epidemiologists. Well, the science is saying that if an immunization is good and an immunization would be helpful, then let's all follow the science together and do what we think is right. And to those who maybe more look at this as some sort of a conspiracy theory, or I think that my own experience in caring for people with coronavirus, our hospital system locally and regionally, nationally, can speak that this is in fact very real and very much continuing, and continues to be a very real threat. And I think that we must not trivialize the lives lost that we will continue to lose by questioning the integrity of good intentioned people, like your doctors and our local health system. I really encourage you to take this seriously, because it is in fact a major health issue for you and those around you. And I think the part of the challenge with an epidemic sometimes is you don't realize it's a problem until it's too late. If you wait until you become sick with it, if you wait until your friend or family becomes sick with it, but if in terms of epidemic terms, it's too late. It's too far out in the population. So, and I think we're already there, frankly. So now we all must, we're all going to have to do things that may be outside of our comfort zone. So I plead with every one of you to get immunized with this. I think it is the one tool we have, in addition to masks and other things, but I think this one can stem the tide. But it's dependent on everyone doing it, and you can't have a large segment of the population not doing it.
Okay.
Unfortunate.
Well, I'd like to first thank everybody for participating in this question and answer session. I'll start with introductions. I'm Kim Bergen Jackson, and I'm the administrator at Oak Knoll, and I'm just thrilled to have so many big players on our Zoom call to answer questions. I would like to read some brief introductions of people, if you don't mind, and I'll introduce the Oak Knoll staff that have joined us as well. Dr. Nick Butler is a family medicine physician and geriatrician at the University of Iowa, and he's our medical director at Oak Knoll. Dr. Winokur, Patricia L. Winokur, is the executive dean at the University of Iowa Roy J. Carver and Lucille A. Carver College of Medicine. She completed a residency in internal medicine and a fellowship in infectious diseases at the University of Iowa, followed by postdoctoral training at the National Institutes of Health. In 1993, she joined the faculty at Iowa, where she's been an active clinician, educator, and researcher. She's nationally known as an investigator in the molecular mechanisms of antibiotic resistance, and also runs an active clinical research program focused on infectious diseases. In addition to her role as executive dean, she also currently serves as senior associate dean for clinical and translational research, as well as professor of internal medicine. Dr. Winokur, thank you so much for joining us on this call. Dr. Jeff Reist is here as well, a clinical associate professor in the College of Pharmacy, where he teaches practice skills, including immunization certification for pharmacy students. His clinical practice site is in the UIHC Department of Family Medicine Geriatric Clinic, where he works on an interprofessional team working with older adults. Thank you very much for being here. And Dr. Corey Canelti is an assistant professor in the College of Pharmacy and the Department of Family Medicine in the Carver College of Medicine at the University of Iowa. Her clinical practice is through the University of Iowa hospitals and clinics as a geriatric pharmacist as well. She runs clinical trials in clinics across the US to examine how we can improve access to healthcare in older adults. Thank you for joining us as well. From Oak Knoll, we have Steve Rowe, who is our executive director. Thanks, Steve. Chrissy Gilbreth, who's our director of human resources. Tyler Sanford is here from IT to handle all the glitches and problems that we might have. And then Betty Winokur is here as the mother of Dr. Winokur and one of our residents. So Dr. Winokur, I think we'll let you get started.
Yeah, so thank you for inviting me. This has been a wonderful week, and it's a culmination of a lot of work that's happened And I wanted to be here to answer a lot of your questions about the safety and efficacy of the COVID-19 vaccines. But just to give you a little bit of background of how we got here, I think the term Operation Warp Speed is one that has caused a lot of consternation in the public. But I want you to realize that the warp speed isn't quite as warped in how we got here as some might think. There was a lot of research that was done on the original SARS coronavirus that was identified in 2002, and a lot of work done when another coronavirus surfaced, which was the Middle Eastern Respiratory Syndrome virus. Because of that research, we had developed a lot of the understanding of what protects people from these pathogens that are very similar to the COVID-19 virus. And so it's not quite the same as something that we've never seen before. We have seen something very similar. And because of that, we'd created vaccines, we tested them in animals, and knew a lot about how to approach the COVID-19 pandemic. The vaccines that we have today have now been tested in all phases of safety testing that we do for any vaccine and any drug. So we did not skip steps. We have done small testing in humans where we did every test that we could imagine. We did electrocardiograms, we did labs that tested their livers, their kidneys, their bone marrow, and we watched them very carefully and saw no problems. We moved to the bigger trials, and normally for a phase 3 trial, we test about 3,000 people. Just think, we've tested 44,000 people for the Pfizer vaccine. That's 10 times the number of people that we typically test. We've followed them for 2 months. Now people say, well, that's too fast. We should have followed them for longer. But we know that the serious consequences of some vaccines, and we see occasionally things like Guillain-Barré with even the flu vaccine, these happen in the first 2 months. So that was the reason that the FDA chose that 2-month follow-up. So we have so much safety data on this vaccine, and we will continue to learn as we get it out into the general public. Many more people were vaccinated even yesterday. More will be vaccinated this week. We will continue to learn. But this is a vaccine that we know a lot about. We don't know everything. We don't know how long this vaccine is going to protect people. That's certainly something that we're going to learn. But rest assured, we have processes in place to follow the people and try and understand some of the questions that we still have. So I'm going to stop and let Jeff talk a little bit about where vaccine is for Oaknoll.
Sure. Thank you, Dr. Winokur. That's excellent information. And I totally agree with you. This has been a very thorough investigation, and I feel very confident in the vaccine. So what I'd like to talk for a few minutes about is how are residents of long-term care facilities going to actually get immunized? So the federal government had made a decision a number of months ago to contract with 2 large pharmacy chains, Walgreens and CVS in the United States. And they will actually be in charge of using their staffs, their interns and pharmacists and nurses and others, to go out into the facilities and set up clinics. So they will actually be immunizing all of the long-term care residents in the United States, starting this month. I've had conversations with both the Walgreens and CVS heads of pharmacy immunization in Iowa, and they've been planning on this for months now, and they have teams already dedicated to this. There's been a huge increase in hiring for temporary employees to manage these clinics. So basically what's going to happen is starting around December 28th, they will be going out into the first skilled nursing facilities. In Iowa, the state is kind of in charge of setting up, who gets vaccinated first. So as I understand it, facilities were asked to select either Walgreens or CVS. And once that decision was made, then the state then gives Walgreens and CVS teams lists of skilled nursing facilities to go into. And they're going to start with skilled nursing facilities, and they're going to start with the largest to get the large skilled nursing facilities immunized first. And this was a state decision, and I heard this from both the Walgreens and the CVS person, is they don't really control, the priority list amongst the different institutions. All of them will contact the administrator of the facility, and they will set up their clinic dates, and there will be 3 dates, 21 days apart, where they will bring a team in on the first clinic date. They will vaccinate everybody that they can in that facility. Then they will come back 21 days later, and then another 3rd visit 21 days later after that. So there will be 3 scheduled clinics 3 weeks apart. The team that will be coming in will be pharmacists, pharmacy interns, which we certify our student pharmacists here at the University of Iowa in the spring of their first professional year. So these students have gone through a rigorous semester-long course that I'm involved in teaching, which is all about immunology and technique, and they give multiple injections to each other. So they're a very highly trained workforce. They will also be tested for COVID-19 before they go out into the facility. So 48 to 72 hours before a team goes to say, oh, no, they will have been COVID-19 tested to make sure that they're not bringing COVID into the facilities. And all of the team members on the teams for both CVS and Walgreens will have the option of getting immunized with COVID-19 when they start employment in that. So they will be immunized as well. As far as which product they're going to use, I talked to Mike Fuller this morning from Walgreens, and he said that they are 100% Pfizer. I do not know for sure what CVS is going to use, but I do know that they have hubs throughout the state that have the correct refrigeration so that they're going to be storing those vaccines in appropriate temperatures. The teams will then go get the vaccine, and it will be, they will pick it up in the containers with the dry ice and transport the facility. So that's they're very concerned about maintaining the potency of the vaccine. So I think we can feel pretty comfortable about that. And that's all I had to say about that. So hopefully that's answered some questions. I know it's been kind of hard to get information, but I think that from what I've heard when I talked to both the people from CVS and Walgreens, I feel like they've got a good plan. They've got good logistics set up. And I feel confident that they're going to be able to safely carry out the immunization of long-term care residents. Oh, and then after the skilled nursing facilities, that's when then they're going to start going to the other levels of care. So assisted living and independent living in that.
Thank you very much. Corey, did you have anything you wanted to add?
I think the distribution, referring to how the vaccine gets here, it's pretty robust plan. We have distribution, logistical distribution we have the coolers that we need, we have the GPS tracking, we have everything, the technology that we need to be able to safely get the vaccines here. So 2020 has been extraordinarily difficult, devastating for many, but I think this vaccine really gives me hope, and it's exciting to have this vaccine come out, and I can't wait to be in line to get my vaccine.
That's great.
And it won't be it's not a cure, but I think it's a larger piece of the puzzle that we have to be able to move on, hopefully.
Thank you. Mm-hmm. So I think we'll start with the questions that we have accumulated. So we asked staff to provide us with their biggest concerns about the vaccine. And so I tried to keep track while you were talking and check some things off. So I'll start with one about a bad experience from a shingles vaccine. So maybe Dr. Winokur, you could respond to this one. It says, I had a really bad experience with a shingles vaccine. The first dose, I had chills, fever, muscle pain, and I could barely get out of bed. I told the pharmacist about my reaction. He reassured me that it would probably not happen with the second dose. Unfortunately, I had the exact same symptoms. I missed 2 days of work that time. Will the COVID vaccine show similar reactions?
So we have been able to look through the Pfizer data for all 44,000 people that were reported. And about 9% of people will have symptoms that disrupt their daily lives. And that's not terribly dissimilar to the percentages with Shingrix. We expect people to have a sore arm. Quite a number of them had a low-grade temp, muscle aches, what I call that flu-y feeling, that flu-like feeling of just being a little under the weather. But remember, 91% of people didn't disrupt their daily activity. So most of those symptoms were mild to moderate in nature. There is no cross-reactivity between the COVID-19 vaccines and Shingrix. So there's nothing that says that because you had problems with Shingrix and had these symptoms that you will have them with COVID-19. But we do expect people to sometimes have side effects. The other thing I will tell you is that we know that the side effects are a little worse with the second vaccine than the first. So that's something that we've observed, and we expect that most people did well with a little bit of Tylenol or ibuprofen and just shook it off. I can tell you I got vaccinated yesterday. My arm is a little bit sore, but I feel great. So
Awesome. I'll stop just for a second and introduce Sam Jarvis. Hi, Sam.
Hey, my apologies for being late, running from one meeting to another, but happy to join, and thank you for having us.
Thank you. Can I just read your brief intro so everybody knows who you are? Sam is the community health manager at Johnson County Public Health, and he's been with the department for over 2 years, serving previously as the emergency preparedness planner, and has over 9 years total experience of local government public health experience. He holds a master's degree excuse me, of science in health science from Western Illinois University and a Bachelor of Arts degree in biochemistry from Knox College. He holds a certificate in emergency response coordination through the Public Health Practitioners Certification Board and is a licensed environmental health practitioner in Illinois. And that's Sam. Sam's been incredibly helpful to Johnson County during this whole pandemic and before. So I'm glad you could join the call, Sam. Betty, do you want to ask a question?
Did the vaccine trials involve the elderly? Did they get the same dose as everyone else? Were their side effects different than everyone else?
Well, that's a great set of questions. So the nice thing about the Pfizer vaccine trial is they did enroll people up to age 85. And we have the data that shows that the efficacy in the people over 65 was just as good as the young people. So that is remarkable. And we know that this vaccine is about 95% effective. The good news about being in that age group is we saw that the side effects were a little bit better than we saw in the young people. So we expect some of you that are in that 65 and older category, not that you are, Mom, but we expect you to actually have fewer side effects than some of the younger people, which is great. So very promising.
Great. Steve, do you want to ask one?
Sure. Can you talk a little bit about the mRNA technology that's part of this vaccine and how it's different than like the flu vaccine?
So the messenger RNA vaccine technology is new. This will be the first vaccine that reaches approval when we get to that point. But it's a vaccine strategy and platform that we have been working on for 15 years. And this is a vaccine that the mRNA vaccine actually provides a code, and it goes into your cell through the injection, and then your cell actually recognizes that code and makes the most important piece of the coronavirus protein, which is the spike protein. It only makes the spike protein. And then it basically waves it on the surface of the cell and shows it to the immune system. And your immune system makes antibodies. So the good news about this is not a vaccine that contains the whole coronavirus itself. It cannot give you coronavirus or COVID-19. It can simply teach your body to make an antibody to that spike protein. Regular vaccines, like the flu vaccine, are a different technology. They basically did the work for the body, and they made the protein, the spike protein, purified it in the lab, and then they inject it into your body. So it kind of skips that step where your body learns how to make it itself, but very similar in the end.
It's so exciting. So let's talk about allergens. So I know there were 2 people in the UK who had an allergic reaction that got a lot of press. And so that's making people nervous who have allergies. And so would you say people with allergies should not get this vaccine, or how should we approach that?
So the US CDC has made recommendations for this. And if you have had a really severe reaction to another vaccine, and by that it's anaphylaxis, swelling of the tongue, trouble breathing, really severe reaction, you should not get this vaccine. If you have a peanut allergy or you're allergic to strawberries or shellfish, you can get this vaccine. And so that, I think, is a very appropriate recommendation.
Thank you. Betty, did you want to ask another question?
I'm just fascinated. I don't know any of these things, and I'm wondering about how well people have to be that are in long-term care things to get the vaccine.
So the only recommendation for health, and remember, when we enrolled people up to age 85, we included people who had chronic medical conditions. They too responded really well to this vaccine and had a very strong immune response. What we don't want is if someone has had an acute illness over the past 3 days, especially fever, then we would not want them to get vaccine on that day and would wait for another day till it's been about 3 days since that passed. But I think we have a lot of safety data, and I think it's going to be safe for people who have medical conditions that might be in places like long-term care facility.
I'm just amazed at how little interest I get from people who live here. They do not ask questions. They haven't read the paper. They don't recognize my name. It's in the paper all the time. And it's amazing to me that you all have been so smart to get involved early in this, and that I feel so secure being there because I know that the people that are working there have been given information.
I think that they're just, they're trusting the system, and they're trusting Oak Knoll to make good decisions. That's a good thing.
That's a good
I don't think that if they announce things, I don't know, we don't know about it. So it's really been amazing to me.
That's good. Steve, did you have anything else you wanted to ask?
Sure. I understand that it's a 2-step process. So we get an injection, and then 3 weeks later we get a second injection. At what point are we fully protected from the vaccine?
So that's another piece of information that we learned when the FDA released the data from the Pfizer trial. The first injection starts to take effect about 2 weeks after you've gotten it. And it prevents COVID-19 illness in about 50% of the cases. So it starts to work. But after the second injection, and about a week after that second injection, that's when we get that full protection where it's 95% effective. So you do want to get that second dose. And that's going to be that's kind of the icing on the cake. The first one gives your immune system a little bit of a hint what to do, and the second one really solidifies that response.
So the residents, I don't see a lot of pushback from the residents and the families about the vaccine, but I'm concerned about the staff not wanting to get it. And so can you speak a little bit about, any of you speak a little bit about what number is our target beyond 100% when we can say the residents are fully protected? What do we do if nobody wants the vaccine? You know?
So Sam, I'm going to let you step in after I'll start, but one of the things that has been interesting to see is as we've been more transparent and people have gotten more information, the willingness to take the vaccine continues to climb. The last surveys that I saw for the US, now 80% of people are interested in getting this vaccine. So I hope that the Oaknell staff will be starting to take some comfort in the data that we have and start to be more comfortable with the idea, just like we're seeing in some of the surveys. Sam ran a very nice survey for Johnson County. Why don't you talk about what you saw in our area?
Yeah, absolutely. Thank you for the question. And it absolutely makes sense that there's some initial concern with all the new information coming out so quickly. But as Dr. Winokur mentioned, every day we learn more and more a bit about this and the correct and right information, and seeing people learn more as well and become more comfortable. Here at Johnson County Public Health, we had initiated a brief vaccine survey initially to healthcare worker staff. And so far we found that a large majority are very interested in getting vaccinated. And I think it speaks to the amount of communication that all of our partners and our hospital partners have provided to their staff and others about the benefits and why this is so important. And so I think we'll only see that to continue to increase.
Thank you. Does anyone else have a question?
One of the list questions that were given to me is, can we see a list of all the ingredients in the vaccine?
So the vaccine ingredients are mostly little chemicals. And Jeff, you can respond. Some people are worried about preservatives. There are no preservatives in this vaccine. The vial doesn't have latex, and so that's good. But this is a pretty pure vaccine. Jeff, you can add to that.
Yeah, I mean, I looked up the ingredients and they're all unpronounceable, but they're all fairly common excipients, we call them. So like every prescription drug and every medicine that we have, liquid and otherwise, has things other than the active ingredient in it, because we have to have things that stabilize it and make it not be degraded. And this vaccine, as you know, because of its very specific storage requirement, being super cold storage, and then once it's diluted and once it's thawed and diluted, it has stability that's a matter of hours or days. So it isn't the most stable product. So it does have some stability type agents in it, but nothing that hasn't been used in other vaccines. And it doesn't have mercury and all of those things that people have worried about in the past. So I feel very confident in the ingredient list.
Thank you.
Were there any pregnant women in the trials? And is there a recommendation if someone knows that they're pregnant?
So we excluded pregnant women in the trials, and that's typical in all clinical trials as we start with people who are non-pregnant. However, there is recommendations now that have come out from the Society of Maternal Fetal Medicine, and they often have to make decisions when we don't have clinical trials data. and they have reviewed the science of how this vaccine was made and are very comfortable that this is similar to many vaccines that they recommend for pregnant women. So their recommendation is, yes, pregnant women should be allowed to get this vaccine, but they should have that discussion with their obstetrician and make a shared decision in how to proceed.
That's huge. That's great. So let's talk about autoimmune disorders. We haven't talked about that yet, but what if I have an autoimmune disorder or I'm receiving cancer treatment or don't have a spleen? I've heard all of those questions. So am I eligible to take the vaccine?
So I think there are two things to think about. When you give a vaccine, there are two major categories of things that we consider. One is safety, and one is how effective the vaccine is at preventing the disease. Again, we enrolled people with kind of minor to moderate autoimmune diseases, but weren't on some of the really robust immune suppressing agents. These people did fine, and we think the safety for these people is going to be very similar to getting other types of vaccines, hepatitis B, flu, other vaccines. Efficacy is one where when your immune system is compromised, maybe by some of these powerful drugs that you're taking, or maybe you're taking cancer therapy drugs, they suppress your immune system, and that's part of the way the drugs work. You may not have the best immune response to the vaccine, but it's going to be better than nothing.
Mm-hmm.
And so we think that these people should get the vaccine. They might not have a perfect immune response. They're going to still have to be careful, but we think it will be safe.
Thank you. Did we talk about what if you've already had COVID? I can't remember.
You have
Okay.
not. And so the recommendations from CDC is if you've had COVID-19 90 days or more ago, you should get the vaccine.
Will we need to get the vaccine every year?
We don't know that yet. That's one of the questions that we're going to have to learn, is how long the protection lasts with this vaccine. All the people that were in the clinical trials, we are continuing to follow them for 2 years. And that's one of the questions that we're going to hopefully learn.
Steve, do you have another question?
Ma'am.
Your reaction to taking it yourself?
What was my own reaction?
You have any response to it that would be negative?
I have a sore arm today, and that's the only thing that I've noticed that is different than usual, but I get a sore arm with most vaccines, so it's not out of the norm. So
Most of
so
you
far,
didn't-
so good.
No, most of you did not miss work or school or whatever.
Only 9% of people had a reaction that was severe enough or significant enough that they missed work or school.
So I would say that we've exhausted our question list for the most part, and I would just ask now that you, this is your final chance to make a pitch to the Oak Knoll community for receiving the vaccine. Of course, everybody on the call is already an advocate for the vaccine, but what would you say to woo any laggards that we might have listening in?
I would just like to add, I know we talked about, how the reaction compares to Shingrix. And as someone who's had Shingrix, I know it is, and I've had a lot of patients since we've had it talk about how it made them feel. But I did find a little comparison chart where you looked at the reaction percentages between Shingrix and the Pfizer vaccine. And I think the local pain and redness is pretty similar. But one thing that struck out at me was the muscle pain, the joint pain in that you get from the Shingrix. was almost twice what was reported in the Pfizer vaccine. So, I mean, it's, you know, we think of Shingrix as probably one of the most temporarily painful vaccines. So, you know, I don't think it's any worse than that, you know, and in some places, in some areas, it might actually be less bothersome. And just like Shingrix, if anybody knew anyone that had shingles, you know, it's pretty easy to be convinced to get the vaccine. And I think as people get to know people that have had some of the severe reactions to COVID-19, it's hopefully going to be more of an incentive to get that vaccine as well.
We have much absenteeism at Oakno of the workers.
No, I don't think we will.
Sam? What do
You know, is in terms of what Kim had asked, is there any final plea to the staff and residents? You know, yesterday was a monumental sight to see our friends at UIHC deliver the first vaccine for this pandemic yesterday at 9:42 a.m. And we're all very excited. We had smiles on our face. Throughout the weekend, we were checking our emails, looking for notifications from the state of when the shipment would arrive. And this is a wonderful step in the right direction, and we're happy to see it. Dr. Whitaker has presented several times, and we've learned so much about this technology that's been around, and that how this vaccine was developed safely and efficiently, and that it's happening now. It's happening today and throughout the rest of this weekend going forward. And it's wonderful to see that we'll be able to be provided this opportunity so we can continue protecting others, our loved ones and family members, so that one day we'll be able to give back to a closer resemblance to normal, where we'll be able to see each other in person and hug each other again and shake hands. People won't be afraid to shake hands anymore. And this is a wonderful step in the right direction. So I hope everyone considers it. I hope they stay tuned, because we'll continue to learn more ourselves, and our partners at our hospitals will provide more information as we learn more, and from our state health department. So this is wonderful to see, and would absolutely encourage everyone to get vaccinated. And if you're on the fence, like I said, stay tuned and learn more with us.
Thanks, Sam.
And I would say being in the hospital setting, we've seen devastating illness, and we have seen this pandemic really turn the hospitals and clinics upside down. I think we've done a great job of managing it, but it has shown how severe this illness can be, and it's not predictable. Some people you would not expect to have severe disease, and they do. The vaccine is the way that we're going to get this pandemic under control. And I think most of us are ready to get back to normal. We want to be able to do all the activities that we did before. And so you saw 100 people yesterday at the hospitals and clinics get the vaccine. They stepped up with a smile on their face. They wanted this vaccine and they trusted it. And we have another 800 people that we're going to be vaccinating in the next couple of days. We are vaccinating as fast as we can get doses. And we have people knocking on the door that want this vaccine. So this is a group that understands that this is the way to move forward. And they are very comfortable with this technology.
Thank you.
And I would just like to say that as a pharmacist, as a scientist, as a sister, wife, aunt, daughter, I'm a cat mom. But I encourage my loved ones, I encourage all my patients, everyone I know to receive this vaccine. I know we've heard this so many times before, but we are in this together. And I think receiving this vaccine is just a necessary step we have to take to controlling this pandemic.
Thank you. Words of wisdom, Jeff?
I think it's all been said, but yeah, I'm anxious to get mine. I realize I'm a little further down because I see patients in the AmCare setting, so I'm in the second wave, but I'm happy to wait my turn, but I'm anxious for it to happen.
Well, I would say we echo that sentiment too. We are we are ready to put this pandemic behind us at Oak Knoll and get the weight of waiting for it to come off of our shoulders. We've been very fortunate here, and we have not seen the devastation that many other long-term care and senior living providers have seen. And I am ready to stop talking about it and stop worrying about it. And this vaccine is the way we're going to do it. So, right, Betty? We don't want to talk about it anymore.
No, well, yes, I do. I think I'm surprised that the people that I live with, are not asking questions. I haven't had a single question. My name's been all over the paper and sort of thing. But I am here remembering when we first got the questions about the other things like polio and things. I've lived through that. And then we would not move into an apartment building that if they found out that somebody there had polio.
Yeah.
So, and it's entirely different. I don't have any questions.
See, we need more people that remember polio, Betty. That's the problem. And we need an Elvis. We do. Well, from the bottom of my heart, I thank you for participating in this call. And Dr. Winokur, I know you don't want to take all the credit, but you get a lot of respect and adoration. And when we can hug again, you better watch it, because I'm coming for you. Because
He's a very, very handsome husband.
well, I'll hug the handsome husband too, but I'm hugging you first. Because I think it will change the way that, it'll just change everything. The vaccine will change everything and help things go back to normal. And we need more normal.
Well, it certainly changed my attitude about it, because I was quite concerned about it, and I've gotten much less anxious now.
Well, good. Hot dog. Any final thoughts?
Just
Betty,
thanks to each of you. We truly appreciate your work.
We do.
And thanks for putting this together, Kim. Thank you so much.
Thank you. I really appreciate all of you. You too, Betty. Thank you so much.
Good. And we've got our fingers crossed.
Fingers crossed. Thank
Bye,
you.
everybody.
Bye.
Take care. Thank you.
Thank you.